Hi, those of you who are here early. Just hang out until we that. All right. So I just want to thank everybody for being here and taking the time to attend this talk. I really want to thank Walter, and before I even introduce him, just to give up some of his time to give us a bit more education, to keep us up to date, and to answer our questions, which is in real time, which is fantastic. I'm Perry Chen. I am one of the personal counselors at Skyline College and with Health and Wellness Services. And we have with us today Dr. Walter Cheng, who is our school physician, and he works he does clinical work in a hospital, but also, yeah, stuttered there a little bit. But his background is in infectious disease outbreaks and has been following the coronavirus for quite a while. And if you haven't seen the first part of his talk, we have, and that was from February 27th, which felt like a year ago, but that is on the Health and Wellness Services webpage. And you can, perhaps after this, you can go there and just watch it. It's embedded right into our webpage. I want to recognize that at 11:30, Skyline College is having a town hall meeting, so some of you may be attending that as well. You feel free to pop out if you need to, of course. We'll be going here as long as we need to. And Walter has asked for this to be kind of like a conversation. He does have talking points to talk about, but if you have questions, you could either ask them in the group chat, which should be down below. You can click on your screen and ask it to everybody, and Walter will sort of answer those in real time and have that guide the discussion. Or you can unmute yourself and ask the question directly. If the talking gets a little bit unwieldy, I will be that guy to mute everybody and take away the unmuting function, and we'll just go to the chat. So we'll try to be kind to each other and try to be thoughtful and try to use our powers, so to speak, responsibly. This is being recorded, so we'll have this posted online someplace. But with that, I just want to give a thank you to Walter for being here and for giving up his time and for bringing some education and to us. So Walter, the floor is yours.
Great. Thanks, Perry. This is the first time I've ever used Zoom, so let's see how this goes. Well, it's really good to see some familiar faces. I know some of you are at the talk, gosh, it's less than a month exactly a month actually ago. And it really, I'm sure to everyone, this world has completely changed in this span of the last 4 weeks or so. To be honest, the talk that I gave a month ago is almost irrelevant, to what's going on today right now. But I just wanted to kind of go over a couple of things. And then, really, I really want this to primarily be a Q&A session, because I'm sure lots of people have lots of questions about, testing, about treatment options, about where this epidemic is going. And, there's a lot of information out there, and I will do my best to sort through it. Again, I think, as I said in my last talk too, knowing that things are changing on a daily basis. So what I say today is really applicable to today, and then things may change, and we might have to do this again in a few weeks, and I'm happy to do that as well. So I think, the take-home message over the last couple of weeks is that, unfortunately, the coronavirus epidemic has clearly taken root in the United States, and it has really exploded in severity here. Whereas a month ago, there were just a few isolated cases here. And we were at that time thinking about containing the virus and containing the infection. I think at this point, it's pretty apparent that our ability to contain and knock out the virus is really not on the table anymore. And what we're really trying to do is to what's called flatten the curve. You probably have heard that term. And what that really means is essentially that we're trying to slow the spread of the disease and slow it down enough so that our healthcare system doesn't get overwhelmed by tons of cases. And I think that, what we're seeing in some countries like in Italy and in Spain is that the number of cases grew so rapidly there that the healthcare system could not handle the influx of cases. And that's led to really, really challenging situations in those countries where doctors have had to make choices about who gets a ventilator and who doesn't. And we see that in New York City starting to emerge, and that's a huge concern And I think, there are some hot spots in the United States right now where some of those worries come about. I think in the Bay Area specifically, I think that the action of the Bay Area counties to initiate the shelter-in-place orders early was a good move. And there are some charts you can find online that actually show that uh, at the time that the shelter-in-place orders went into effect in the Bay Area, the number of cases in the Bay Area and the number of cases in New York City were almost the same. But New York City waited 6 additional days to do the shelter in home orders over there. And now their cases are something like 15 times higher than the Bay Area. And I think the take-home message about these types of epidemics is that early action is key, because the spread of the virus grows exponentially. And so it snowballs out of control very quickly. And so acting quickly is imperative. So I think the Bay Area did a good job. And currently speaking right now, the good news is that, since I'm on the front lines in the hospitals right now, our hospitals are not overwhelmed yet, although we're not going to expect to see a peak for another 3 to 6 weeks or so. So we're cautiously optimistic, but I think it's just critically important that people still continue to keep apart from other people, to socially distance right now. Or actually, I don't like the term social distancing. I think we should be physically distancing, but being socially in solidarity, but to be physically distant, to try to reduce the spread of the disease. So, I think that's the big take-home message I have to say right now, is that I think this social or physical distancing is in place. It's clearly having some effect here, which is great. And so the people who are doing it, keep it up. But I do want to kind of put a dose of reality in that, there's some talk in the administrations, particularly by our president, that he wants to reopen up things, very soon. And I think that, at least from a purely public health standpoint, is not a good move. So actually, Perry, did you just throw that question out there? Okay. Are we seeing accurate number of cases with respect to testing kits being available? That is a very good question. So the answer is no. We do not have an accurate number, nor do I think any country has an accurate number. There's, even in countries which have tested more, I think that there still isn't testing capability. For instance, here in the United States, essentially right now, the only people who can get tested are frontline health workers with symptoms, because obviously we want to make sure that we aren't passing the disease around, and then people who are sick enough to be hospitalized. There are a few other cases where you can get tested, but generally speaking, if you have mild symptoms, you will not be tested right now. So we do not have an accurate number. I think the most accurate thing right now, we have the accurate number of deaths and the accurate number of hospitalizations from the disease. And I think that's actually important. So, and Cassidy, this question, how can you tell our peak will be in 3 to 6 weeks? What will that look like for us? Well, these are best guess modeling that we're doing right now. So I think that we're using some data coming from China and from South Korea, because those are the 2 countries right now that saw big peaks in cases, and then they've gotten it under control. And typically speaking, they saw, a peaking effect about 6 to 8 weeks after the virus really started to spike. And so, we're about 2 to 3 weeks into our spike now. So the hope is that we can get this under control in 3 to 6 weeks. But obviously, the actual peak is unknown. A lot of it's going to really depend upon how good are we as a population of adhering to these guidelines. Also, we have to, think about how well how well coordinated our federal response and state response is going to be. So I think there are a lot of unanswered questions. And also the other concern we also have, not to scare everyone, is that there could be a peak where things come down. But as we start to mingle society again and people start to interact, will we start to see secondary peaks occur? This is the social experiment going on in China, where they're starting to allow some more movement in Wuhan and in Hubei province. And I think they're hopefully, I can't speak for the government there, but I hope that they're doing monitoring to see if more people start to get infected. I think we'll learn more information, but it's still a moving target. So these are good questions. We've got a lot of people here. Other questions, throw them out.
I got a question.
Okay.
I was going to type it out, but I figured I'll just unmute and talk.
Yeah.
I've heard things about seasons in summer and fall, and how might this affect our peak, or things we should be, I guess, individually. Will things get better over the summer, and then will it just get worse again in the fall? What does it look like for us as a society, and also for us sort of individually?
That's a great question. I think I wish I could give you an exact answer. I mean, a lot of our modeling is based upon influenza and our knowledge of how influenza works. Coronavirus is a somewhat similar virus in the way that it's spread. And so obviously, we think there might be some reduction as things get warmer, but there's we don't know for certain. So I think there's a lot of unknowns right now. So I wish I could give you an answer, but I can't. So, got a bunch of questions coming in here. Should I just go ahead and just go through them? Okay. So it says here, with many states not practicing social distancing and closures, do we run the risk of a prolonged quarantine here in California? Well, that's a good question. So actually, many states are practicing social distancing, and closures are actually pretty common throughout most of the U.S. now. Although the whole shelter in place, that's kind of another step beyond social distancing, is not being done in many states. It absolutely does. One of the challenges right now is that, each state here we're not independent countries. And so, just because we're doing shelter in place doesn't mean that someone from Nevada or Arizona couldn't cross over and bring in stuff. So I think that, so I think, again, because we don't have a great currently federal policy on what to do, and there are disjointed maneuvers by different states, that certainly it does risk the prolongation of the quarantine or the shelter in place here, because obviously if other states start to develop very severe outbreaks, then and there's risk of those people coming into California, it might prolong the epidemic here too. So that's that. Next question is it risky to shop in crowded stores such as Trader Joe's and Costco even with social distancing? So that's a great question too. So there is some risk, and I think the risk comes down to a couple of things. So I think most of you guys have been shopping now, and I certainly, when I go and need to get groceries, they've been limiting the number of people going into stores, and then we've been waiting outside, in lines about 6 feet apart. Is that what everyone is experiencing? Like, yeah, I see some thumbs up. So I think that helps to reduce the number of people moving around in stores. That said, obviously there are points of contamination. So the grocery carts, if you touch them, can be sources of contamination. Obviously, products that you touch could be contaminated. I think that the best thing to do right now is you need to shop, and you need to get groceries, and that I understand that. I think the best thing to do is to limit the number of times you go, and to have a very dedicated list of things you need so you're efficient while you're in there. Minimize the time. The other thing that I do is, as a doctor, when I went to medical school and I was learning how to go into the operating room, one of the things you learn is that once you walk into the operating room, you're sterile, right? So you can't touch your face, you can't touch anything. Once you get those gloves on, you can't do anything. So I've been kind of practicing that when I go to like the supermarket. So essentially what I do is, the minute I touch the cart, right, I'm in dirty space. And so I'm just really, really cognizant, because you can't get the disease from just touching something. You got to touch something and then touch your face. And obviously you try to keep best as you can 6 feet apart from folks. So what I've been doing is, the minute I touch the cart, I don't touch my face. And when I check out of the line, I get the groceries and I walk home with them. Once I drop the groceries off, then I wash my hands, right? And then I'm good for a while. Then I unload the groceries and I wash my hands again. That's how I've been doing, and I think that's how I've been approaching the risk point of it. So I think, you have to do shopping, but you just, got to be careful. So lots more questions here. From Guillermo, I'm trying to keep things in perspective. In this regard, are the deaths reported due to the common flu higher or lower than the coronavirus? So I think the question here is a good one here. So I think that what we are seeing is that the death rate from coronavirus appears to be higher than the flu, and certainly even higher than typical. We can be comparing it a lot to H1N1 flu from 2009. But I think that the overall death rate is going to be higher. Right now, we're seeing death rates somewhere between 1% and 3%. I think the actual rate will be under 1%, but typical flus have death rates of like 0.1 or like 0.05%. I think that coronavirus is more deadly than flu. It's also probably more transmissible than flu. So this is why I think it's so important to be very, very serious about this and to try to slow the spread, because I think that the impact on society is potentially greater than flu. Next one here from Lauren is how long, this is actually Perry, this is a private message here, so I don't think you can see it, but it says here, how long is the estimated time for shelter in place? How many months should we expect to live like this? Well, I think we've alluded that earlier. I think that the question, it's unknown. I think that it's not realistic to think that this will be lifted in 2 weeks, which it's scheduled to. I mean, I think the shelter in place is through April 7th, but I don't know. I think it'll be extended past that. And to be honest, I think once it's lifted, it's not as if it's a light switch that turns on and off. I've been telling people the best analogy to think about this is that if you've got like a broken pipe, and you shut off the water, right? So you shut off the water and you're trying to figure out where the pipe burst is, and you see like what you think is the hole and you fix the hole. The thing that would be the mistake is to turn the water on with full pressure right away, because you might not be able to guarantee that the fix you put in was the actual fix you needed. And so I think that when the shelter in place is going to be released, it's going to probably be released slowly, so you can see if things start to leak again. And that's what China's doing by the slow sort of, resumption of movement. They're not just letting everyone go everywhere. So just expect, I think, that the shelter in place will probably go on for at least a few more weeks. And then there'll be sort of gradations of relaxation that will span at least a few months. But honestly, it could, on the worst case scenario, things may not be totally normal for a year, just to be honest. So, someone wrote, it's also efficient to at least wipe the cart before using it. Yes. If you bring wipes, that's not a bad idea. It's hard to get wipes. So I understand for people who can't get their hands on wipes, I'm giving you like sort of the worst case scenarios. Just once you touch that cart, don't touch anything on your body until you can wash your hands. But if you have wipes, that's great. Next question. If you are taking care of someone with COVID-19 and they are no longer exhibiting symptoms, does the caretaker need to be in quarantine when they return to their home? It's a good question. So the guidelines right now is, unfortunately, we don't have enough tests to confirm if someone has cleared the virus. So we're using two guidelines right now to say that someone can come off of quarantine. And so let me answer the question specifically for the person with COVID-19 and then for the caregiver. And so technically speaking, for the person who is diagnosed with COVID-19, they are considered clear of the infection currently if it's at least 14 days, it's 14 days from their positive test or 7 days from their last fever, whichever is longer, okay? For the caretakers, though, is that if they are caretaking for a COVID-19 patient, they are considered potentially at risk for getting that infection until that person is clear. So from the point the COVID-19 person is clear, the caretaker has to self-isolate for 14 more days after that, right? Because technically speaking, we don't know if the COVID-19 person is clear until 14 days after their test. But on that 14th day, technically speaking, they could have transmitted it to that person. So that person who's taking care of them should self-isolate for another 14 days past that. So that's Emily's question. Thanks. Oh, Donna's got a question here. Hi, I have 3 grandchildren at home with me, 6, 11, and 16. Is it good for them to go to go work and play in our backyard? Can we take a ride just to get out? We would not stop anywhere. Yeah, so if you're at home with them and you're quarantining with them, and it is perfectly fine for them to be out in the backyard and playing. It is probably okay for you guys to go out for walks, again, maintaining 6-foot social distancing from everyone. Going for a car ride is fine. We've seen people in parks. I think some of the parks have gotten a little overcrowded, but if you're walking to your local park and just maintaining distance from other people, that should be fine. So go in the backyard, play around. You do not have to be inside the house. From Hope Letting. So then, is wiping, sanitizing all the products, groceries you bring into the home overkill if you're not in a high-risk population? It's probably a little overkill. I think, I mean, you, how can I put it? I guess what it, I think that the risk of picking up coronavirus from grocery shopping is pretty low. I think what I've been doing is I'm lucky that I actually have a whole canister of Clorox wipes. So what I've been doing is I've been wiping down, like, when I get home and I take groceries out, I have taken a wipe and wiped down like my milk cartons and the glass bottles. And obviously for fruits and vegetables, I've been washing them before I eat them, and I'm just washing my hands a little bit more frequently. I think that's all you can do. I mean, you can't get 100% of everything, so you just do your best. And here's Cassidy. We talked about masks a month ago. Are they still only good for those who are in the healthcare field or sick, or for those who are sick themselves? Oh, yeah. So that's a great question, Cassidy, about masks. I think right now is we have a huge masks shortage. And I think that masks are most crucial right now for the healthcare workers who are on the front lines. And so I actually tell people that if you are well, that wearing a mask in public really doesn't serve much of a role unless you're going into a crowded space. So because grocery stores, for instance, are trying to practice social distancing, then the role of masking yourself in a grocery store shouldn't be necessary unless you feel that the grocery store is not doing a good job of keeping people apart. And it's and the masks that you guys buy commercially, like surgical masks and even like the industrial grade N95 masks, because they're not fitted for your face, they offer sort of unknown protection for you. Now, if you are sick yourself and you're coughing, well, you should stay home, but you have to go out. Wearing a mask might be helpful, but I'm telling you, just don't go out, So I think I'm sorry, I'm being a little bit verbose about this, but I think honestly right now, there really doesn't seem to be much of a role for masks in the public as long as we maintain social distancing. That's really the best thing for the public to do. And we really should be reserving the masks for healthcare workers because frankly, there just aren't enough. And a lot of healthcare workers are putting themselves at risk right now. And we can't lose those workers because if we do, then who's going to take care of the sick people? Because I'm telling you right now that we're only seeing the very beginning of this epidemic. There are a lot more cases coming. From Julio, are we to expect an increased risk of infection to where we will need personal protective equipment beyond gloves and masks, face masks? I don't think the risk of infection is going. I wonder if your question, Julio, is regard to healthcare workers. I think that for healthcare workers, the protection that we're trying to use, which are gloves, gowns, and N95 masks, are probably sufficient with some data that I've read coming out of Asia. I think that for the general public, there really isn't a role for any of the personal protective equipment. I think it's social distancing is what needs to be done right now. From Susanna, do we need to disinfect our groceries when we bring them home? So, I think I mentioned that. I think the data, it's not clear. I think what I've been doing is, if you have wipes, to wipe down things and obviously wash your produce and, wash your hands after you have, touched, come back from the grocery store. So, should we go out for a walk? How to take precautions when people are walking past by you? So yeah, you actually absolutely should go for a walk. I think it's good for everyone's mental well-being to get out and get some fresh air and get some sunlight. Yes, I would say to just obviously avoid crowded areas. If you are going to walk by people, the guideline is to just maintain that 6-foot distance. So if you're on a sidewalk, just try to walk on either end of the sidewalk and try not to cough towards them if you need to clear your throat. Yes, Stephen confirmed that. Yes, you can go for a walk. Hope here wrote, I thought you can also sanitize with the bleach solution if you don't have Clorox wipes. Yes, that's a great question. So if you can't find Clorox wipes, you can actually make your own solution. If you do have bleach at home, the solution is 1 part bleach to 99 parts water. So 1% bleach. And you can put that in a little spray bottle and you can use that to sanitize. So you can spray that onto like a paper towel and wipe things down. Just so you know, that bleach solution, don't do it on your clothes because it'll bleach your clothes. You can also make, if you can't find hand sanitizer, there is another hack you can do, which is to use so the alcohol content has to be 60% or higher, so your vodka won't work. But your hard liquor won't work. But what you do is you take 100% rubbing alcohol and you put 2 parts rubbing alcohol to 1 part aloe vera gel, and you mix it all up and you get 66% alcohol in a gel, and you can put that into a bottle as well. So 2 parts, 100% rubbing alcohol, and 1 part aloe vera gel. I heard that was kind of sold out a couple weeks ago, but that might be coming back online, but you can make your own hand sanitizer that way.
I just want to jump in real quick.
Yeah.
In your local areas, I know I've been hearing that some distilleries are starting to move over and actually start making hand sanitizer. And what I've heard is you can bring a bottle, and they're selling it by the ounce. So be on the lookout. Check if you're using Nextdoor. They might have that posted. But where I am, there's a local distillery who is I think they converted some of their vats to make some hand sanitizer.
Oh, great. That's perfect. Will the wipes kill the virus on the spot? If not, what to do with the wipe when you have to hold on to it for a while? No place to throw it away. So the thing about wipes is that actually the wipes kill the virus not on contact, actually. So when you wipe with a wipe, it actually kills as the alcohol or the cleaning solution evaporates. So actually what you do is you wipe and you have to let it dry before you actually really should touch it. Which again makes it hard to wipe down the grocery carts because you have to basically wipe it down and let it dry, before you actually touch it. And what do you do with the wipe when you have to hold on to it for a while? Well, and the wipe itself the viruses shouldn't be able to live on it. So, I don't have a great solution. Someone mentioned, I read an article about someone bringing like a little Ziploc plastic bag and they put their wipe in there. When they're done, they seal it up. I don't know. I think it's a little overkill. I think if you wipe with the wipe, because the wipe contains the solution, you probably should be okay holding on to it and just throwing it away. Oh, this is a great question from Jose. Can you clarify the connection between the use of ibuprofen and COVID-19? Does using NSAIDs increase the chances of getting the disease? So this actually got quite a bit of press a few days ago about the use of drugs that are called NSAIDs. They're non-steroidal anti-inflammatory drugs. There's 2 main ones over the counter. There's ibuprofen and naproxen, and ibuprofen comes as Motrin or Advil. Naproxen is Aleve, that you probably have heard of. So there were some reports out of France. I think French and which are actually worsening the infection, but Tylenol didn't do that. There's some new data that actually show that probably isn't the case, and the official World Health Organization guidelines state that it's okay to still use ibuprofen. So I think the jury is still out. So should you not use ibuprofen? My medical advice is if that's all you have and you have a fever, you should use it. But if you have Tylenol and there's no reason you couldn't use Tylenol, maybe to use that for now, until we get more information. So, so here's a private message if I can share. I won't read the name here, but I apologize for being random, but I'm having difficulty breathing through a surgical mask. Would there happen to be other people that may feel the same as I do? Absolutely, yes, which is another reason why we actually don't want the lay public to use a surgical mask, because oftentimes, the difficulty breathing can be that the N95 type of mask is designed to not let you breathe in 95% of the air, right? So it's filtering 95% of the air. So the work of breathing required to wear that mask is higher. So typically as medical professionals, when we use N95s, we limit ourselves to about 10 to 15 minutes at a time, at most 30 minutes. It's not meant to be worn 8 hours at a time. And almost anyone would tire out using an N95. With a plain surgical mask, it also can be a bit suffocating to some people too. And again, it depends on how you're wearing the mask, and so again, why I don't really recommend the lay public to be using masks, especially if they're really in uncrowded situations.
I don't want to show myself.
Oh, that's okay.
Can't hear anything.
Hello? Hello?
Oh. Luciano, we saw that you were trying to say something, or maybe it might have been an error as well.
Yeah, okay. We'll continue on. So question from Perry here. Question on sanitizing gel. Do I have to wait until it dries as well before I'm good? Yes, you do. So I think I explained to people last time how to gel, and I'll kind of reiterate again. I don't have a gel on front of me, but the key thing is you put the gel on your hand, and you have to wipe for about 15 seconds until it's totally dry. And what you want to do is do the palms, right? And remember, you also want to get the webs of your fingers, your thumbs, and then you also want to kind of get your fingernails underneath your fingernails. And that action, and also the backs of your hands. So let me just repeat again. Palms, webs, thumbs, back of the hands, and the fingernails. When you do that, the gel will completely evaporate. So you're not considered protected until it's all gone. And your goal is to try to get it all over before it's all dry. So does that make sense? Okay. Okay, and from Cassidy here, I'm hearing now the higher risk category is changing a bit. Being a healthy 22-year-old, am I also now at risk? What are the higher risk categories now? So the higher risk categories are changing gradually, but I think the key components are over the age of 60 and certain comorbidities. And the comorbidities are underlying lung disease. So actually, the risk factors are over 60 or underlying lung disease. So that includes things like asthma, emphysema, other lung diseases, underlying heart disease, such as coronary artery disease, things like that, diabetes, and immunosuppression. So if you're on immunosuppressive drugs, or you're immunosuppressed for one reason or another, that includes things like HIV infection. Even there's some data, questionable data on well-controlled HIV infection, whether that's an increased risk or not. That's still a moving target right now. Those are generally the categories. So age over 60, lung disease, heart disease, diabetes, history of cancer, or if you're on drugs that immunosuppress you, or you have an immunocompromised health state. But healthy 22-year-olds, you're not considered high risk, well, you're not a high risk. Everyone is at risk with this. So another question here. As a yoga teacher, I am practicing deep breathing and encouraging my students to practice their deep breathing for relaxation. Is that advisable, or does it increase possibility of absorbing the virus into air passages? A good question. I think that what you're doing right now to practice deep breathing is actually very, very good, especially from a mental health perspective and a mental health well-being perspective. I think trying to help people combat anxiety right now and be mindful is so important. And I don't think that deep breathing is going to impact the likelihood the virus will get down into your lungs. So please don't stop doing that. So I think that's perfectly fine. Younger children, infants, toddlers, any particular cause for concern? They weren't listed in your high risk list, but wanted to ask. Yeah, so I think I mentioned this a month ago too, and I think the data continue to show that in general, younger children have less serious disease than older people. I do want to say is that, like, should every age category be concerned? And the answer is yes. We actually, unfortunately, had a case of a 17-year-old who died in California. I think the youngest case in the United States that's died from this is age 12. So it's not to say that it cannot cause serious disease in younger people. So what I want to say is basically it can cause severe disease in everyone, but it affects more the people who have those risk categories I mentioned before, but everyone is at risk. So younger children should still be protected, although fortunately the rates of severe illness are lower with that category. So that's good. Okay, is there an FDA-approved treatment right now? Will an infected person be cured in 2 to 3 weeks, as I have read in an article? In China, I have read they have fed the patients with huge doses of vitamin C and treat the patients. Yeah, so there actually are no FDA-approved treatments right now for coronavirus. There are a number of clinical trials ongoing right now based upon data that we've started to get from Europe and from China. There I don't want to belabor the point. So there's one experimental antiviral called remdesivir. There's also a look, you may have heard our president talking about this, about the uses of drugs called chloroquine and hydroxychloroquine, which are anti-malaria drugs. There's also clinical trials ongoing with the use of certain HIV medications, with interferon treatments. Nothing is FDA approved right now, and certainly other homeopathic and naturopathic medicines have also been explored. At the moment, right now, we don't know what actually works. So we don't know. Have to go to Skyline Town Hall. Well, thanks, Jose. Next question. Is it right that viral infections are self-limiting in nature? Well, I think that coronavirus infections will probably be self-limited in that people who clear the virus will clear it. Obviously, our concern is that some people develop severe complications that can, impact their risk of dying from the disease. But certainly not all viral infections are self-limiting in nature. Some viral infections, namely things like HIV or herpes or can be lifelong infections that your body cannot clear. So it runs the gamut there. So I was like going through all of these questions. I hope this is helpful for everyone so far.
I've got another question, actually, since we have a little break in here, and I'll just ask it live. With all kinds of news flying around on news feeds, social media, etc., what are, I guess, your recommendations for finding accurate information? Where do you get your information? What are some good, reputable places where we can get, accurate news?
Yes, that's a great question. There's a lot of misinformation out there. I think that if you want really detailed information, the CDC website is pretty accurate. So the Centers for Disease Control, at cdc.gov. I generally think that some of the major news outlets, the New York Times in particular, has pretty good information out there. I think that obviously I get a lot of my information from scientific journals, which are not written for the lay public, and so that might be a little bit hard, to read that because you do need some technical knowledge for that. But I think the Centers for Disease Control in particular is really good. Also, the independent county Department of Public Health. So San Francisco Department of Public Health, San Mateo and Santa Clara counties also maintain their own websites, and I think they have really good information, particularly specific information about testing centers, what things to look out for. And so I think those are good sources of information as well. If you want statistics about how the epidemic is doing, the New York Times also has a coronavirus tracker, as well as Johns Hopkins University has a coronavirus tracker as well, if you want to use that just to look at numbers. A flurry of questions just came. Let's see, I have to scroll it back up here. Back to the question about deep breathing. When I was hospitalized after surgery, a nurse told me to breathe deeply because it will decrease chances of, I think it's URI, so upper respiratory infection. So does this mean deep breathing strengthens our immune system? So that's a great question. So it's not that deep breathing strengthens our immune system per se, but what deep breathing does, or at least the medical belief, is that deep breathing helps to recruit air into the lungs better and opens up those air sacs, the alveoli that are the little air sacs at the ends of your lungs. And so rather than being collapsed down so oftentimes after surgery, the air sacs collapse down and you don't bring in air very well. So bacteria can really grow in that environment. There's no air flushing things out. So what deep breathing really does is just to help clear out mucus in your respiratory tract and get all that gunk out. So that's generally what the medical belief about deep breathing is. Next question. Is there some concern that COVID-19 will come back in the fall like the 1918 flu? Absolutely. That's a huge concern because obviously our goal right now is to quote unquote flatten the curve. But we know that even if we look at the data on China and South Korea, so well, I don't know how much I trust the Chinese data. It's always a little questionable with their government, especially how they dealt with the SARS epidemic. But if you take the South Korean data, they actually got a huge spike in cases, got up to about 8,500 cases or so, but they were able to do very good contact tracing and get it down. The problem, though, is that there's still millions of South Koreans right now who are still not immune to the virus. And so it's certainly possible to come back. So, if they start to loosen travel restrictions, so people start to bring the virus back into the country, 99.5% of the country is still not immune. So could there be another epidemic? Absolutely. Obviously, our hope by flattening the curve, basically two main goals. One I alluded to earlier is that we don't overwhelm our healthcare system with too many cases all at once. But the other thing we're hoping to do is to buy time. So we're buying time to try to find treatments that might be effective, or a vaccine that can protect people, or something like that. That all takes time to develop. And so we're putting in such strict precautions right now because we don't want 50% of people to get it right in the first wave. We can't handle that, right? And so if we can keep the number of infections down right now, so that'll be better, because when the second wave comes, which it probably will, we might have more tools in our tool belt to actually combat this better the second time around. And says here, once a person has had the virus, can she become ill in the future with the same virus? The answer is technically no. So you can't actually get infected by the same virus. You will develop immunity to that. The problem with coronavirus, kind of like influenza, is that the virus mutates and mutates very fast. We don't have enough data right now on whether the different strains of coronavirus can cross-infect. But obviously the concern is that, this coronavirus may change in the next year to something that even if someone got it and is immune to the original coronavirus, they may be susceptible to a mutated version of it. So I don't know yet. Which food should I eat to boost my immune system? That's a good question too. I think that what we've been telling people is there's no specific food that's been shown to be, better or worse for this particular infection. However, I think the key thing right now is to really focus on eating a very balanced diet. So I do really, to avoid, processed foods, to avoid, to really just focus on good, healthy, balanced diet right now. If someone is pregnant, does that put them in high risk group? How will COVID-19 affect pregnancy in general? That is a very, very good question. And actually that's a focus of a lot of research right now. I actually did a little reading on this. We don't know, actually. So I wish I could tell you what its overall effects on pregnancy are. I have not heard of a loss of a pregnancy due to this virus yet, but I just don't think we know the information yet. So I would say that I would say though, I think pregnancy is always a high risk point in a woman's life. And so if anyone is pregnant, they should take extra precautions with the social distancing. Let's see. Okay. Not to belabor the anxiety of going out in public, but I've heard the virus can last in the air for up to 2 hours. Where does this leave us with regard to going on walks? I was scared walking in the park yesterday with all the wind. Is it blowing viral particles toward my face, even with 6 feet distance? That's a good question. So actually the wind is helpful. What the lab tests that were showing that the coronavirus could stay alive in air for 2 to 3 hours was based on a laboratory setting, and generally speaking with viral or bacterial respiratory bugs, is that your concern is actually stagnant air where things are in space. So actually, to be honest, the most dangerous place is to be in an unventilated, unlit room that someone who was sick in had been in for a prolonged period of time. So what we're talking about is someone, let's say with coronavirus, who was sitting in a small room, coughing there for an hour, and they left, and you walk in 30 minutes later. That's, I think, a high risk situation. Actually, if you're outdoors, especially if the wind is blowing, when the wind blows, that stuff gets dispersed very, very quickly. So the likelihood you would get, the infection in an outdoor setting would be very, very, very low, because there's so much air. And so one breath that comes out gets dispersed so fast that the likelihood of you picking it up in the outdoor open space is extremely low. let's see. Can I know what the difference is between coronavirus, COVID-19, and SARS-CoV-2? Great question. So coronavirus is a catchphrase for a group of viruses. So of which this particular coronavirus is one type called SARS-CoV-2. COVID-19 is the disease that SARS-CoV-2 causes. So basically, there are a family of coronaviruses, and the thing that's causing the actual epidemic is a virus called SARS-CoV-2. And the reason it's called that, SARS stands for systemic acute respiratory syndrome. There was SARS-1, which was in 2003, and this is SARS-2. And this causes a disease called COVID-19. And the reason it's called COVID-19 is that CO stands for coronavirus, CO stands for corona, V stands for virus, ID stands for, I think, infectious disease, and 19 is the year 2019 when the virus was isolated. So coronavirus, group of viruses, this virus causing this problem is SARS-CoV-2, and it causes a disease called COVID-19. Great question about, can pets catch and transmit the virus to their owners? The answer is, we're not 100% sure, but probably not. Probably not. So that's all I can say. Can you repeat who was it that had the tracker with numbers? Oh yeah, so there's two trackers that I've been using. One is so if you type in, if you go to the New York Times, I think you can look up their coronavirus map. The other is Johns Hopkins University has a coronavirus map as well. So if you just Google Johns Hopkins University coronavirus map, it'll link you right there. Okay, well, next one. What is the official list of symptoms? I have heard a few times that nausea or stomach pains has also happened in some patients. It's hard to block out all the bad media surrounding this pandemic. Yeah. So the list of symptoms, not everyone has every symptom, but the most common symptom is a dry cough. So dry cough occurs in probably about 80% of people. And so that's a little different than other types of pneumonias, which usually cause like a wetter cough with a lot of like phlegm. So the hallmark of this is a dry cough. Fevers is probably the second most common. So fevers occurring in about 60 to 80% of people. And then, body aches and body pains are pretty common as well. The problem, obviously, is this sounds like a lot of other colds and flus you might get. So it's very, very hard to truly distinguish between the two. With regard to the GI issues like stomach pains, diarrhea, that has been reported, and there's been some reports of being able to actually isolate the virus in stool samples, although typically diarrhea or nausea and vomiting has been seen in about 10% or less cases, so it's not as common. All right, moving on. Can the food delivery transmit the virus through food package right now? Yes. So yeah, there's a lot of questions about that. So, technically food delivery could transmit the virus. I think it'd be very low. As I said, I think if you take just sort of mild precautions, in that if you pick up a package from someone, let's say you get a UPS or an Amazon delivery in a box, could coronavirus be on there? It's possible. I mean, it's possible that the UPS guy sneezed on your package right before they gave it to you, or the delivery person had dirty hands. I think from a food preparation standpoint, obviously California Health Department guidelines do have regulations about food handling. So hopefully the restaurant you have has a good health rating. If they do, the food product itself should be okay. The packaging, I can't guarantee, but what I would just say is, get the food, put it on your plate, and then when you throw away the packaging or open the box, just wash your hands before you eat, which you should be doing before you eat meals anyway. So that's what I would say. Does UV light kill the virus? Probably. So I think people refer to UV light trays for phones and things like that. I think that there's some efficacy. I don't know 100%, but probably UV light has some effect. The problem with UV light, though, is that some people have to recognize that UV light itself is actually very damaging to certain materials. And so they've actually done a study actually at my institution at Stanford where they were trying to think, oh, how could we safely reuse masks if we sterilize them? And they tried using UV light, and that actually degrades the fibers of the mask. And so it's not recommended for that. So if someone has had, I think, pneumonia or bronchitis before, will they be more at risk? Probably. So I think if you ever had any lung damage in the past, that probably puts you at somewhat higher risk. It really depends on what sort of permanent lung damage might have been done. So, but if you've had a mild pneumonia or a case of bronchitis here or there, I mean, we all had bronchitis at some point in our lives, probably not. But if you've had a very severe case of bronchitis or many, many pneumonias in your lifetime, probably there's some increased risk, so you should be careful. Should I sleep frequently because I'm at home and nothing to do? Will it boost the immune system? Well, I think you should have healthy sleep. So I think all of us right now should be focusing on, being well. And I think getting a good 8 hours of sleep is really good. Now, should you sleep excessively? I don't think so. And I actually, if you, I think this is a time Perry may want to talk about this. I think when we're in periods of high stress like we are right now, certainly issues of depression and anxiety can be huge problems. And I think that people who feel the need to be in bed all the time, it could be a sign of depressive symptoms. So should you sleep frequently? The answer is you should have balanced sleep, focusing on 8 hours of good sleep a night. But should you be in bed all day? The answer is no.
And just to quickly chime in, I completely agree with what you're saying, Walter. Focusing on sleep, diet, and exercise with physical distancing, of course, or exercise at home. Practicing wellness is very good for our mental health, and which also has a significant impact on sort of our immune functions. And so being able to maintain wellness is very good for us. I also want to do a quick time check. It's 11:55. We'll spend another 5 more minutes getting through these questions, and then we'll wrap up.
Okay, sounds good. I'll try to go through these fast. So a lot of questions here. So I've seen articles about blood types having something to do with COVID-19, that blood type A is more at risk than getting the virus than blood type O. Is this true or false? So that's a great question. So there were some initial data coming out of China this time that showed that people with blood type A might be at higher risk. Again, that has not been corroborated by any new data. So I think the answer is we don't know for certain right now. So maybe, but again, moving target, lots of research needs to be done. What is the current thought on seasonality of the virus? Will the upcoming warmer climate help slow its spread? I think we've alluded to that a little bit. I think we just don't know. We don't know yet. Is it considered a risk if a food preparer is a carrier and accidentally has saliva or droplets from their mouth land on cooked food? That's a good question. So if it's landing on cooked hot food, probably not, because the virus really can't live on hot food, or that food that's actually cooking, so things that are boiling or being grilled. It'd be very hard for the virus to stay alive. Now, obviously, food preparers should have been taught, on proper food preparation. So obviously they're not going to sneeze or cough on the food, theoretically, so let's put it this way. Foodborne illnesses can always be transmitted. You've probably heard of hepatitis being transmitted through a restaurant that didn't follow rules. So is it possible that a food preparer could transmit it to you? Yes. If they're following proper hand hygiene and sanitary hygiene, this should not happen. Can we call it Chinese virus or Wuhan virus? No. So I think it's very, very important to recognize that the virus has no identity. And we know that when we label viruses from the areas that they come from, that's actually very stigmatizing to the populations where they come, the populations that are from there. And it's very, very important to know, because the only purpose that's served by naming this virus the Chinese virus or the Wuhan virus is to stigmatize a region. And I think that that's not fair, because this virus has no discrimination against any human, and every human is at risk. And so I think that it doesn't serve us any good to label it that way. I mean, frankly, it's interesting to me how, again, I don't want to spill my politics too much, but our president has used the term Chinese virus, which is very, very off-putting to me, but he continues to call the H1N1 flu just the swine flu, because it came from pigs. But he fails to recognize that the swine flu came from pigs from Wisconsin. And so really the H1N1 flu, if you want to use this terminology, should be called the American flu or the Wisconsin flu. But we don't do it in America because we don't want to take blame for it, And so just as like we don't want to take blame for that, the Chinese should not be blamed for this virus. This virus emerged, and these viruses can emerge anywhere. We're all at risk for getting it. So let's just call it for what it is. And not where it came from.
Well, thank you very much, Walter. That was like a whole a barrage of questions, and really, and here comes some more now.
Well, I do want to say one thing. I do. This last question, I do want to say one thing about smokers. Yes, I think smokers are putting themselves at higher risk. This is a great time, if you're a smoker, to think about quitting smoking. If this is motivation for you, please do it. It'll have great downstream effects besides this coronavirus, but this is a great opportunity to think about quitting smoking. So.
Mm-hmm. And you can see on the chat, people are just coming in and thanking you. Thank you so much for not only your time, but your knowledge and just the thoughtfulness you put into answering all these questions and the information you bring. You really are an asset to us, and we really thank you for being a part of our community and just for making yourself available. Good luck with your continued clinical practices. And for everybody else, thank you for being here. Stay safe, stay healthy. Remember, practice physical distancing. Practice all your wellness things with your diet, your exercise, and your sleep, and be well. And we'll be seeing you around.
All right. Thanks, everyone.
Thanks, everybody.
Bye-bye.